Welcome back, everybody, to the Internal Compass podcast, where I, your host, Samuel Archambault, is trying his best to help you and to teach you more about pain management and to make you more realigned from inside out. On today's podcast, we have a very deep and very exhaustive topic, and we're going to talk about back pain, especially lower back pain. I decided to make an episode on this topic because, in my opinion, and with my clients that I see almost every day, if not every week, I tend to see that low back pain is something that comes and is there often. So I decided, okay, let's make a full episode on back pain and especially lower back pain. In 20-25 minutes, I'll try to condense as much as information as I can. So here's what you can expect in today's episode. First, I want to talk about the different causes, potential causes of lower back pain, because after today, if there is one thing that you will probably remember, is that low back pain and back pain in general is very unique to each individual, meaning there is no one back pain and there are many different factors that can lead to back pain. So I'll try my best to expose you the different causes and then also the different factors to take into consideration. Maybe debunk some myths and some pre-made ideas, maybe some beliefs that you might hold yourself that are not necessarily helping you to feel better. So we'll try to debunk that together. And then after that, we'll go into the treatment. How can we get rid of back pain? How can we heal it? So let's start. Different causes. Of course, there are probably thousands of different causes of back pain, but let's start with the basic. Your back, your lower back, we refer especially to your spine. So yes, there can be an affectation to your spine. Let's start there. Let's start with what could be a potential cause of back pain regarding especially the bone, especially your spine. Well, of course, it could be something as traumatic as a fracture. If you have a fracture, I'm telling you, you will probably know it, meaning there's probably going to be some type of a trauma, some kind of a hit, an accident, a big fall, something that you will feel and you will know that, oh, something's not right. And at that point, there's no question, you just go to the hospital. I think this is very important to point out. Most back pain are not necessarily something that comes out of trauma. There are something that might be triggered by trauma, especially get worse over the weeks, over the months, and for some people over the years. What can cause that? Other than a fracture for the bones, other than that, we can look at degeneration of the bone itself, and especially the density of the bone. In that case, that might be linked to osteoporosis. So that's basically the density of your bone. How is it dense? It loses this density over time. But also something more like arthrosis. So that's meaning that over the time, there's a lot of use in your bone, and therefore that will create perhaps extra bone around the joints, so between the vertebrae. And at that stage, this might limit your mobility and therefore creates a little bit more pain where you try to move. If we switch more towards the muscle, which after a few years of experience, I've noticed that yes, muscle, it's a big reason why people have back pain. And because muscles are a structure, a soft tissue that will respond to a context, to something that's happening. Meaning if you have lack of mobility or other very specific situation that doesn't allow you to move properly, well, guess what? Muscle are going to try to pull left and right to try to make you a little bit more stable and especially respect your posture. So yes, it could be a strain, right? It happens to all of us. We go forward, we try to pick something and we come up. It could be something very light, doesn't have to be something big. We try to come up and we feel something in our back and maybe a muscle just gets past, meaning this muscle tried to protect you while you were going down because it felt that you were going to go above your safe level of range of motion, meaning that if you would pass that, then maybe you would have compromised some very important structures like the spinal cord or your disc or your nerves around. So the muscles are going to tighten around it. And then if that muscle is not treated, well, guess what? This muscle can stay into this contracted position and can create a little bit more pain. So that's another reason why you can have back pain. Another thing that is not as discussed is genetics. Yes, your genetics and from who you come from can have an influence on your back pain. See it like this. Some people have more straight spine, some people have more curved spine, some people have scoliosis, and that is impossible to predict before you're born, basically. And as you grow into an adult, that's where you will notice those things. They are not necessarily bad. Having a scoliosis doesn't mean necessarily that you will suffer from back pain. Neither is the same thing if you have a straighter spine or a more curved spine. In a general setting, a curved spine is something that is a bit more associated with a spine that is able to absorb a bit more shock, so maybe less prone to back pain. But nevertheless, there is no specific association or correlation, meaning if you have any of those things, it doesn't mean you have back pain. But it can be part of that. Because yes, it is in genes that back pain can occur. That's one thing that we can control. But don't worry, there's a lot of different things we can control to heal our pain. So you're not doomed. It's not your fate to have back pain if you feel that you do. There are probably a lot more chances that it's on in contextual factors and not because of your genetics. If we look more now at the spine, it's right. A lot of people might think, especially if I have this tingling feeling in the leg or this numbness, this lose of force, am I having a nerve impingement? And yes, that can come from the disc that is in between your vertebrae. That disc acts as a cushion. It helps you absorb shock. So of course, over the age, or if you have some type of a trauma, this can either degenerate, meaning that this disc can become a little bit more compressed and therefore absorb less shock, creating a little bit of pain, or it can bulge to one side to another. So if I apply pressure to one side of the disc, where the disc will tend to go a little bit more to the other side. All right, so if I flex to the left side, my disc wants to bulge a little bit more to the right side. That's normal when we move. It's expected because that's how our spine has. But if we keep doing that, and especially with a lot of force or an extreme range of motion, the disc can literally bulge somehow from its position. And the thing is not necessarily the disc that is a problem, but it's the compression of the disc over a nerve that might create those symptoms or this pain that you feel. That's another reason. Again, right now I'm stating all different reasons why you might have back pain. It's probably not only one, and it's probably not all of them. So the goal here is maybe start to scratch your head thinking it might be one, it might be the other, but knowing what it is actually will help you better manage your pain after that. In some rare cases, now I'll be stating a little bit more rare cases, it can happen. In very rare cases, I'll say it again, that there might be some other things that are compressing nerves and that are limiting your range of motion. There is a specific condition called spondylolisthesis, and that's a very complicated term. Just means that you have a vertebrae that is slipped, especially the lower vertebrae. If you can imagine what it does to have a vertebrae that is more projected forward, well, can create pain and also a lack of. But not only that, we can see some things as tumor, also so cancer on the side of the bone or on the side of the disc. That can also create some compression over the nerve and create some pain. For women, of course, pregnancy, menstrual cycles, and the cramps associated with it, those can all be things that can also create back pain. Just as recently, I have this one client that she's pregnant right now, and she's having some weird symptoms of back pains that comes and goes. And it's probably caused by the fact that her uterus is getting so big that it's compressing nerves and other structures and also changes her gravity center, right? You have a bit more weight in the front. And of course, because of that, well, your back has to compensate and readapt. So it might cause a little bit pain here and there. There are other diseases we could go through. Yeah. Kidney stones. Those are all more rare, I would say, but still potential causes of your back pain. So after now, you should be able to scratch your head and say, if I'm having back pain, which one of them is it? And the real reason is it's hard to say by your own. That's why you need to consult a professional. And that's why you need to consult people around you that can dictate and can do some objective test, objective measures to see, okay, is it this? No, is it that? And try to eliminate and at least try to target one, because it's by knowing what's the cause then that we can treat it. But the cause is not the only thing, meaning that it doesn't mean that your low back pain is caused by that. It is only resolving that strain that will fix the whole. There is more to just a reason why it might affect, because now we've been talking, of course, about more biological reason, mechanical reason, physiological reason, so things that kind of happen to your body. But there are other reasons why you might have back pain. Those are not necessarily causes, but they might be considered more as factors, meaning if you have those elements that I will state, you're maybe more prone to have back pain. So it's not a cause, it's more like a factor. Obesity, overweight, a sedentary lifestyle. Your back, like any other joint of your body, is made to move in space. So of course, if you have overweight on your body, this might create a little bit more compression, and more compression equal more force, equal more potential pain. Again, is there a clear correlation and causation between obesity and low back pain? Not necessarily. Some people that are very obese or very overweight don't have any back pain. And the opposite is true. Some people that are very thin might have back pain. So you see, it's a factor. It's not necessarily a direct cause. A sedentary lifestyle, of course, most of back pain dissolve. If you look at data, will go away after few days, if not few weeks. I think that right now the top is something like 6 weeks. Most back pain I'm talking about. Meaning that most back pain is probably just a message from your body saying, hey, you need to move, you need to do something. Something's not right. So, hey, I'm sending you a little message. I would say, just to give you a little nudge right now on the potential tactic that you can use to heal your back pain, move. Just go for a walk. As simple as that, and see how it feels. Of course, a walk is not going to solve everything, but it's a good start, because if you start walking and you feel better, there's a high chance that your low back pain is not necessarily related to a very specific medical cause, but it's just probably because you've been inactive for some time, and that right now your structures are kind of yelling, hey, we need some movement. So that's the first trick that you can use. Very simple, but so far we've noticed that science tells us a lot more details about how it works, but somehow it brings us back to very simple solutions, such as walk a little bit more. So now that we've covered the different causes, let's go in maybe more causes that can be in interrelations with more anatomical parts. And right now I'm going to take a step back and put my osteopath hat on, and I can tell you a little bit more about what type of structure can influence your low back. I would like to approach this specific topic because I teach that, and I try to educate my clients when they come to see me when they have back pain, because knowing why they have back pain helps them feel better. And that's being shown right now in the literature. So on your low back, on your spine, there's a lot of different things that attaches there. Of course, we can think of muscle, such as your hip flexors. Yes, they attach to your lower back. So of course, if you have very, very tight hip flexors that pulls your low back forward, that might be something that by releasing it might help. There are other muscles, such as the quadratum lumborum, which is on the side of your low rib, so your 12th rib, and that goes all the way to your iliac. It's the bone that makes you go from left to right, so inclination from left to right. This can also, if it's too tight, can kind of compress your rib cage down to your iliac. So by releasing that, that can be another thing. Third muscle that I want to talk about is the diaphragm, your breathing muscle. Yes, it's under your ribs like an umbrella, but deep down, the periods of the diaphragm attaches to the lumbar spine. So of course, if you have difficulty breathing and you're very stressed and you cannot move properly your diaphragm and activate it, well, guess what? If it's really, really tight, this might also pull on your low back. That's for the muscle only. Of course, now we've covered if we have lack of mobility between each vertebrae, that could be something, and that could be due to many different reasons. Maybe because you don't move it enough. Maybe because, again, there is a medical reason why you can't. Maybe it's because there's not enough strength or mobility in the specific joint. But of course, if you have a specific vertebrae that cannot move properly, for example, from left to right or from forward to backward, this can also create back pain. And now, just to be clear, it's impossible for you to have a displaced vertebrae. You would be dead, okay? Because in the middle of your vertebrae, yes, you have your disc, but just in front of that, you have your spinal cord. So if it's displaced, that means that it would rupture your spinal cord, and that will be fatal to you. So don't worry, you don't have any displaced vertebrae, other than if you have a very specific medical condition that I talked about a bit earlier, where this vertebrae goes a little bit forward. But that do not compromise the spinal cord. Other than that, there are also reasons why your organs could pull on your low back. Example, your small intestine. The root of your small intestine, the mesentery root, is on your low back. So of course, if you have IBS or if you have inflammation in your gut, this can create some tension that will pull on your low back. Are there specific association and causation between what I'm just saying and lower back pain? No, it's not stated in the literature as we speak. But there's if you just do some clinical reasoning and think, interesting, that example, if I have a lot of back pain and at the same time I have a lot of inflammation in my small intestine, there might be a link. And yes, I feel when I treat my patient that when I release those different structures, then this can definitely help the person feel better. And that's not magic. It's just physiology and basic mechanic. Remove the tension, remove the pain. More tension, more irritation to the nerve. So that was just a little side note here on my osteopathy version or perception of what can cause back pain and what type of structures I would personally treat and have a first look at before I do anything on someone who has back pain. And quickly, I might talk about one of my clients that recently, let's call him John, just to give him a name. And John came to see me, very, very stiff low back. And after treating it, I've actually did the same thing where I just told you that his diaphragm was completely spasmed, couldn't breathe at all. And just by releasing diaphragm and the small intestine, his low back was much better afterwards. So see, sometimes it's not necessarily a disc bulge or a nerve. Even if it's that the root cause that is compressing, might not be exactly the nerve. It might be something else that will compress it, because a nerve dysfunction by itself is really, really rare. Most of the time, it's just another structure that kind of irritates the nerve and that creates this pain or then those sensations in your leg. Okay, next step I want to dive into is the interesting relationship between MRIs, so magnetic resonance imaging, how we perceive back pain. And I want to share with you some studies that I've come across here. And the first one I want to talk to you about is a study called Systematic Literature Review of Imaging Features of Spinal Degeneration in Asymptomatic Population. In English, what does it mean? It's basically they've done a whole review of the scientific data that's available, and they look at, okay, people who they don't feel pain, let's look at their MRIs. Let's look at their back through imaging. So they went to the doctor, they took those imagery, and then they looked at what percentage of that population have a dysfunction in their body, meaning maybe they have a disc bulge, maybe they have degeneration of that disc. And I say that again, that all of that population was asymptomatic, meaning they did not feel any pain. Just interesting, hear me out here. It was conducted over 3,000 people, so 37%, so that's approximately 1 out of 3 of 20-year-old, and 96%, so almost everybody, 80-year-old individual, had a small disc degeneration, meaning that their disc was starting to be less and less capable of their disc was being less and less capable of absorbing shock. Almost 100% of 80-year-old. And those people, they were not in pain. Those people that were being tested on. Another interesting percentage, disc bulge, that's where the disc kind of goes sideways and irritates the nerve. 30% of 20-year-old had it, and 84% of 80-year-old, meaning that it doesn't, what this study shows, in other words, is that it doesn't mean that you have some type of disc degeneration or that you have some disc bulge that automatically that will create pain. What is more? There must be more than just this, because if it would only be related to what's happening on a biological level, on a mechanical level, then it would automatically translate into pain. But clearly, it's not. So there might be something more. I want to show you another one. So, association between magnetic resonance, so this MRI, and low back pain. So they've looked at over 10 years. They took a group of people, and basically they were looking at, okay, are those people with doing the MRIs, are they still having pain? Guess what? Overall, the result is that over 10 years, even with people who had low back pain, it did not really correlate with the fact that those people had a positive sign on the MRI. In other words, over 10 years, all those people, there is no clear sign that shows that if I have something on the MRI, I'm having back pain. And also the reverse was true, meaning that it doesn't mean I have back pain, that I have something positive on the MRI. Some people had a lot of back pain and had a really clean back on the picture, in more simple terms. So see, there are a lot of those things. I can continue on here. I have another one calling no association between MRI changes in the lumbar spine and intensity of pain, quality of life, depressive and anxiety symptoms. So another super interesting study that shows a little bit more the same thing, but added some other factors, meaning that if you look only at the picture, okay, we already knew that basically it doesn't, there's no association with the level of pain. But not only that, it also showed no association with the quality of life, if the person was depressed, if there is any anxiety symptom in patient. In other words, if you have low back pain, you feel like your life has really low quality, you feel like you're limited, you feel very depressive because of that. There is absolute no data right now that shows that this is being associated with the picture. So once again, there might be something more. And I want to tell you all of those things because there is something more. And therefore, that means that we need to approach low back pain not only on the mechanical level. So many of my clients think that they have back pain because of this exact vertebrae, this exact disc. They like to put the finger right on the thing and say, it's because of that. Once that is healed, then everything will go better. Well, no, it's not only that. There are much more to this. There is the psychology around it, and there is also the social factors around it. I want to talk to you about that because I think it's really important. When we feel back pain, there are different responses. There is fear to move, right? What if you have back pain and then you move again, and then you expect this pain to come? You might also have this kind of avoidance. Not only you have fear, but you will avoid specific behaviors, specific movements, because you don't want to recreate your pain. And you might also be catastrophizing, meaning that because of that back pain, nothing else is possible, and that you kind of project this fear into another level. All of those behaviors might be normal at first because basically your brain is trying to protect you, but they're a little bit counterproductive because actually science shows that one of the best way to heal back pain is movement, and that especially for back, our spine is made to move, meaning that if you just completely stop and do nothing, that actually makes it worse because it's kind of locked in that back pain. So that's definitely not what we want. So how do we approach this? Now that we know that, okay, back pain has many different potential causation, but we also know that it's not only those mechanical, those physiological, or those mechanical causes that will create pain. It can be, by the way, but it's probably more a mix of many different factors. So how can we approach this in a holistic way? And I think that's the right way to approach this, because if we approach it only on the medical side, I think we're losing out here a big piece of the cake that we're trying to approach. First thing we want to do is approach it with the biopsychosocial context or approach. That's some kind of a strategy or concept that arrived in the last maybe 5 to 10 years. It's taking a lot more places when it comes to pain management. It's not that complicated. We will split it into the three parts: bio, psycho, social, meaning bio for biological. And that's the part where we want to address really what's going on in that mechanical, physiological reason. Yes, we also want to address that. And then the psychology around that. How can we deal with pain on a psychological level? Because clearly, I told you, it's creating fear. It might create this catastrophizing, this avoidance. This is not something that your brain tricks you into. It's something that is being developed because of the psychology around it. So we must include that in our approach. And the last one is the social piece. What's the context? What's the environment? Do we have access to support? Are we able also to talk about our pain with else? Are we having the right professionals around us? So see, that's another approach that we can take at. So let's start with the biology one, the one that maybe you might be the most interested into. There are different ways to do it, but of course, what we want to do is treat that pain, treat the potential causation that, after evaluation by a proper professional, might say, okay, this might be the thing. So in other words, if you have a muscle strain, you'll have to treat that muscle strain. So for that, maybe you'll use manual therapy, physiotherapy, maybe you'll use some warm and cold. Those are all options that works. When it comes to muscle and joint health, there are three components that are really important to take into consideration. First one is being flexibility. Do you have the flexibility in your muscle to be able to reach specific range of motion? So if a client comes in my office, they have back pain and everything is stiff into their body, well, guess what? I'm going to help them work on some flexibility. So some stretching, especially this deep stretching that goes to the end of range of motion, and then you will stay there for maybe a minute or two to really relax the muscle. That's a good way to start. It will just give you a little bit more space in the area. Then after that, after we have flexibility, then we want to work on mobility, meaning, okay, you have now the capacity to move a bit more so that the muscle can elongate a bit more, but can you move properly into that space? And for that, we need your muscle to actively work, meaning, can you move your spine into the different direction using your muscle? Can you go from left to right? Can you go forward and backward? And can you rotate? All of those things will be addressed with specific mobility exercises. Again, I strongly encourage you to not take anything that you find on the internet. Please hire someone that knows what they're doing, that can assess you, because I will say it again, back pain is something very individual. Not only the biology part that now we're talking, but also the combination of the bio, the psycho, and the social. Therefore, having someone from the outside that can assess that is definitely a big plus, and you're going to gain many months, or if not many years of work by just having someone that can help you. So once we have now worked a little bit more on mobility, then we want to work on stability, meaning if I'm capable to move into different plane, different range of motion, can I have good stability? And especially for the low back, that means your core. Can your core be connected with your legs? Can be connected with your torso and with your arms properly? So when you move, when you do any type of activities that you do, when you lift something, can you be properly stable so that the muscles that you want to works properly, and that you're not relying only on your spine and on your ligaments? That's especially important for people with hyperlax joints, meaning that their ligaments are not supporting fully the joints. If you're hyperlax, you probably know, but if you don't know, again, consult a professional to maybe assess you, meaning if you have like very, very large and very extensive flexibility, that might be something that you want to look yourself in. Flexibility, mobility, and then stability. And then after that, we're going to work on some strength, because yes, having more strength, being able to be stronger, that will definitely help you have more resilience. So next time you fall on the ground, next time that you slip or someone throws something at you, you have to hold it quickly. If you're stronger, then you're going to be more able to use those muscles to absorb the shock and not your low back. So in that order, especially. If you're curious, there is this one concept called the Big Three by McGill. I will put a link into the show notes. If you are curious about that, I will put a link to a YouTube video, which are basically 3 exercises that have been shown to have really good impact on low back pain. And again, those exercises are not the magic pill, right? They can help you to build that stronger core, that more of that stability piece, and also this strength piece. So we're talking about side plank, the bird dog exercise, and also this very specific crunch as well that you do laying on your back. I'm not going to describe them all here, so if you're curious about, just click on the link in the show notes, and then you'll be able to dig a little bit more in. The last thing I would like to say is, after you've built all of that, make sure that you have specific corrective exercise for you that can help you connect those different things together. So have specific exercise for you about your flexibility, because not everybody needs to stretch the same thing. Not everybody needs to mobilize the same thing. Not everybody needs to be stable in the same area. Some part of your body might be very stable. Let's say if you have a very stable hip, but your low back is really the problem, or vice versa. Maybe it's your hips that are very unstable and therefore your low back is kind of compensating. Then you want to address this differently. And same thing for the strength part. So, and for that, you need a proper assessment. So make sure that the next time you go see your healthcare professional, either a personal trainer specialized in rehabilitation or a physiotherapist, those people can help you, and just tell them, I would like to address my flexibility, my mobility, my stability, and then strength. Normally, this is pretty much what those professionals are going to go and run you through that kind of a routine. Now, this is for the biological part. What about the psycho part? Well, I will keep it very short and sweet, meaning what works the best is CBT, cognitive behavioral therapy. I have already made another episode on that, so I will put, or at least I have started to talk about the topic. I will put again the episode link into the show notes, so if you're more curious about that. But basically, if you're curious more about CBT, it's this technique where you will look at your beliefs, at when you think about your low back pain, and maybe you have those fears and you have those catastrophizing or those avoidance behaviors, then what can you do from there to kind of change that? Because yes, this will have a major impact on how you perceive pain, not only psychologically. In your body, really, like those sensations of pain are going to be reduced. There are really significant data on there, especially for chronic low back pain. So basically, this goes from this form of ABC. What's the activating event? What happens that if I have low back pain, then what is this thought that is being created? In other words, what's the activating event, which would probably be your low back pain? And then what's the belief behind that? Is the belief that now that you have low back pain, you can't move anymore, you can't travel anymore, or you can't insert whatever you you tell yourself that you can't do anymore there? Try to identify this belief. And then after that, you might want to go more into the C part, right? A, B, C. So A for activating event, B for belief, and C for the consequence. What do you do or not do in consequence of that belief? Identifying those 3 things is the first step to really help you change that. And again, there are also CBT therapists that can help you go through that. So that's another option if that talks to you a little bit more. The last part, the social part, is something that we tend to put away, but is very important. And the social part is this: what's the social context into which you're having your pain? Meaning, do you have access to care? I'm telling about all those professionals, but can you afford them? This can look like a stupid detail, but it's really not, because it can really determine the outcome of your pain. So trying to put yourself into a situation that you have the most support from professionals, from friends, from family, but also maybe from a pain. Yes, those those type of group exist. So putting yourself into a situation where you're not being put down because of your pain, but you're actually being encouraged to seek for more help and to go through the process like step by step, that will definitely help you because it will boost and support that psychological side, and it will also motivate you to do those different exercises that you have to do. And maybe one last thing is to adapt your environment. Of course, if you have low back pain, maybe then you want to not necessarily put yourself into, okay, I'm gonna completely change my lifestyle because of that. Maybe then you want to, hey, if you have chronic low back pain and you notice that you can, by walking, it helps you. Well, then maybe you start to go to work by walking, if that's possible. Maybe you use your bicycle and you are a little bit more active. Maybe you change some of the part of your day that you're able to go outside and go for a walk. So you see there's a lot of behavioral tools that we can use and social context also that we can change, that's under your power, that you can change to try to make some tests to see what works and then what doesn't. You don't have to be prisoner of your life. You can decide to change few details that in the end can make a big difference. So this was a very short and sweet, but also packed with information about low back pain. So I hope that after today, you're able now to maybe understand a little bit more the different causes, potential causes of low back pain, and also that you take away that it's not only the mechanical, the physiological part of this back pain that is relevant. But no, there's also the psychological side and as well the social side of it. So therefore, your approach to your pain needs to be integrating all of those different aspects. Hey, thanks for watching, and I will see you in 2 weeks for another episode of the Internal Compass podcast.